We will talk about the sialadenitis and sialolithiasis. Like I said, two of them are very common in the exam. So one is the salivary stone. You can see that salivary stone. And the buzzword here is painful lump under the tongue. Painful, a person eating and notices a painful lump in the jaw that comes and goes. Painful lump. So sialolithiasis is just stone blocks saliva flow. So that is it. When there is a stone that is blocking the saliva stone, the saliva flow, that is sialolithiasis. That is stone. That is stone. But so that is stone. There is a stone in the salivary duct. So the stone blocks saliva flow. Pain and swelling is noted, like I said, especially during meal time, and it can lead to secondary sialadenitis, which we will still talk about. So that is just salivary stone. So how do we manage this? Just hydration, warm compress, warm compress, gland massage, okay, goggles, so to stimulate the flow. But the major thing here is they can do take the person to ENT so that they can remove the stone. So it's just a saliva, the stone blocks the saliva flow. So you can see the stone, it blocks the saliva stone, the saliva flow. And we said it occurs especially when the person is eating. It can cause painful lump under the tongue. There is pain, swelling near the ear or under the jaw, dry mouth, greasy or strange tasting saliva, difficulty opening their mouth, and difficulty swallowing. So that is your sialolithiasis. Lithiasis is stone, sialolithiasis. Then the next one is sialodenitis. So what is now sialodenitis? Sialodenitis now is an infection, is an inflammation of the salivary gland. So there is now infection, inflammation of the salivary gland, and we say that what can cause it is sialolithiasis. So because it's an infection, it's an inflammation, it worsens with eating. Okay, patient may have those signs and symptoms of inflammation like fever, erythema, tenderness. Patient can start having those signs and symptoms of it. So how do we manage sialodenitis? Of course, the major thing here is warm compress, hydration, but antibiotics. So here they will need antibiotics, but they don't need to remove the stone. But in sialolithiasis, we will remove the stone. So this is example. Okay, this is a different. This question is under the candida, oral candida, and but example in this one. Let's look at this one. A 50-year-old male presents with pain and swelling in the floor of his mouth, especially after eating. What is the most likely diagnosis? So the buzzword here already told you that that patient have pain and swelling in the floor of the mouth. So it's always worsened with eating. So, and what is the most likely diagnosis? Then this question here A 30-year-old patient presents with recurrent painful mouth ulcers. Mouth ulcers. The ulcers are small, round, and have a white or gray base border. What is the most likely diagnosis? So we have talked about this earlier. That was the aphthous stomatitis. So the buzzword is painful ulcer in the mouth. They can use a magic mouthwash. But here they have something that looks like that they have something like a stone, but the patient complain of pain, especially with eating. So that is your Sialolithiasis. So in comparison, Sialodenitis is an inflammation, Sialolithiasis is a stone, and Sialodenitis, the treatment is antibiotics, but Sialolithiasis is usually surgical procedure. Refer the patient to ENT and they will remove the stone. So the same thing here, the same slide, a different slide, but talking about the same thing. And the mnemonic for Sialolithiasis is salivary stone. It is triggered by eating. There is obstruction in the duct. It is non-infectious. Elicit stone passage, so they can massage it. So use the mnemonic stone, Sialolithiasis stone. Then the next one is swell for Sialadenitis. Swell. So Sialadenitis. So remember this one is inflammation. So it is warmth and erythema. E. Evolve with fever. L. Localized pain and tenderness. There is a pain because it's inflammation and it's always at the parotid or some mandibular swelling. Then you have the L, which is likely bacteria or viral. So another question now. A 45-year-old female presents with pain, swelling, and redness over the right side of her face, particularly around the jaw. She reports She reports that the symptom worsen after meal. What is the most likely diagnosis? So that is Sialadenitis. Sialadenitis. So patient have the swelling. That is another question. So patient have the swelling. They have the redness over the right side of the face, and it has to do. Remember the symptoms: pain, swelling. So there is an inflammation going on. So that is Sialadenitis. Sialadenitis.